Hello, and welcome to my channel. Today we are talking about septic arthritis, a condition that is very different from the more common types of arthritis, such as osteoarthritis or rheumatoid arthritis. Although septic arthritis is relatively uncommon, it is considered a medical emergency. Without prompt treatment, it can quickly damage a joint and in some cases become life-threatening. The good news is that if it's recognized early and treated quickly, many people make a good recovery. In today's video we'll discuss what septic arthritis is, the warning signs and symptoms, who is most at risk, what causes it, how it's diagnosed, treatment options, recovery, and when you should seek urgent medical help. Let's begin. Septic arthritis is an infection inside a joint. Unlike osteoarthritis, which is caused by wear and tear, or rheumatoid arthritis, which is an autoimmune disease, septic arthritis is usually caused by bacteria entering a joint. The infection causes severe inflammation, swelling, and pain. Without treatment, bacteria can rapidly damage cartilage and bone inside the joint. The infection can also spread into the bloodstream, making the condition much more serious. Because of this, septic arthritis should always be treated as a medical emergency. Septic arthritis can affect almost any joint. However, the most commonly affected joints are the knee, the hip, the shoulder, the ankle, the wrist, the elbow. Usually only one joint is affected, although more than one joint can sometimes become infected. Children are more likely to develop infections in the hip, while adults are more likely to develop infections in the knee. In the next section, I shall go through the symptoms. Septic arthritis usually develops very quickly. Many people become unwell over just a few hours, or within 1 or 2 days. Common symptoms include sudden severe joint pain, a swollen joint, redness around the joint, warmth over the affected area, difficulty moving the joint, pain even when resting, fever, chills, feeling generally unwell, extreme tiredness. Unlike osteoarthritis, the pain usually comes on rapidly, rather than developing gradually over months or years. If you suddenly develop severe joint pain along with fever, or a swollen hot joint, seek urgent medical attention. I shall now explain what causes septic arthritis. The most common cause is bacteria entering the joint. This may happen when bacteria spread through the bloodstream from another part of the body. Examples include skin infections, urinary tract infections, chest infections, dental infections. Bacteria can also enter directly through cuts, animal bites, surgical procedures, joint injections, penetrating injuries. The most common bacteria responsible are Staphylococcus aureus, although other bacteria can also cause septic arthritis. Less commonly, viruses or fungi may be responsible, particularly in people with weakened immune systems. Who is most at risk? Anyone can develop septic arthritis, but some people have a higher risk. Risk factors include older age, rheumatoid arthritis, diabetes, a weakened immune system, recent joint surgery, artificial joint replacements, skin infections, intravenous drug use, taking medicines that suppress the immune system. Having one or more of these risk factors doesn't mean you will develop septic arthritis, but it's important to be aware of the symptoms. This next section explains how septic arthritis is diagnosed. Because early treatment is so important, doctors will usually arrange investigations as quickly as possible. These may include joint aspiration. A needle is used to remove fluid from the affected joint. The fluid is tested to look for bacteria, white blood cells, and signs of infection. This is often the most important test. Blood tests. Blood tests may check for infection, inflammation, bacteria in the bloodstream, imaging. Doctors may also request X-rays, ultrasound scans, MRI scans. This helps assess the joint and identify any damage. Now we will look at how it is treated. Treatment usually begins immediately, often before all the test results are available. Antibiotics. Most people receive antibiotics directly into a vein through a drip. Once the infection starts improving, they may switch to antibiotic tablets to complete the course. It's very important to finish the entire course of antibiotics, even if you begin to feel much better. Draining the joint. Removing infected fluid helps reduce pressure and allows antibiotics to work more effectively. This may be done using a needle, arthroscopic surgery, open surgery in more severe cases. Some joints need to be drained more than once. Pain relief. Painkillers help improve comfort while the infection is treated. Your healthcare team will recommend the most appropriate medication for you. Recovery varies depending on how quickly treatment began, which joint was affected, your overall health, whether any joint damage occurred. Many people need physiotherapy after the infection has settled. Exercises help restore movement, strengthen muscles, improve flexibility, reduce stiffness. Some people recover fully. Others may be left with some permanent joint damage, particularly if treatment was delayed. What happens if it is not treated? Without treatment, septic arthritis can become very serious. Possible complications include permanent cartilage damage, joint destruction, osteoarthritis develops later, bone infection, bloodstream infection known as sepsis, reduced mobility. This is why rapid diagnosis and treatment are so important. When should you seek urgent medical help? Seek immediate medical attention if you develop sudden severe pain in one joint, a hot, swollen, red joint, fever with joint pain, difficulty moving the joint, feeling very unwell, together with severe joint pain. Don't wait to see if the symptoms improve. Early treatment can prevent permanent damage. In the second to last section, we will look at whether septic arthritis can be prevented. Although not every case can be prevented, you can reduce your risk by treating skin infections promptly, looking after cuts and wounds, managing long-term health conditions such as diabetes, following advice after joint surgery. Seek medical help if a joint suddenly becomes swollen and painful. If you have an artificial joint, report any signs of infection to your healthcare team without delay. Living after septic arthritis. Most people gradually return to their normal activities after treatment. Recovery takes time, and it's important not to rush. Continue with physiotherapy exercises, medical follow-up appointments, healthy eating, gentle activity as advised, taking medication exactly as prescribed. If you continue to experience pain or reduced movement after treatment, speak to your healthcare provider. Additional rehabilitation may be helpful. Septic arthritis is very different from other forms of arthritis. It's caused by an infection inside a joint and requires urgent medical treatment. Recognizing the warning signs early, seeking immediate medical attention, and beginning treatment quickly can protect your joints and greatly improve your chances of making a full recovery. Thank you for watching. If you found this video helpful, please give it a thumbs up and subscribe to my channel for more easy-to-understand videos about arthritis, joint pain, and healthy living. If there are any other arthritis topics you'd like me to cover, please leave a comment below. Take care, and I'll see you in the next video.